What's something you want people who are not in the medical field to know about the pandemic?
It's real. It's real.
The biggest thing is it's real.
Number one, that it is real.
It is real. It is not a hoax.
The virus isolates us, and that's not good. We depend on each other. We depend on each other in everything.
I'm Dr. Billy Mullen. I'm currently Chief of Anesthesia at Logan Regional Medical Center and Critical Care.
I'm Dr. Marzouk, the intensive care doctor at Logan Regional Medical Center. I'm also the pulmonologist and the intensive care director.
My name is Gina Browning. I'm a registered nurse here at Logan Regional.
Hello, my name is Jeanette Sexton. I am the Chief Nursing Officer at Logan Regional Medical Center.
Vicki Demers, I'm the Chief Operating Officer, and right now I'm filling in as interim CEO as well. So Logan Regional Medical Center is located in Logan, West Virginia, which is in southern West Virginia. We're a 140-bed short-term acute care hospital with provides ER services, surgical services, inpatient, outpatient. We also employ around 20 physicians. We work with the community as a partner. We do have a board of trustees at the hospital that we work with as well to make decisions and plan for the future.
What was one of the biggest challenges you or the hospital faced in the past year?
The virus. The virus is a really big challenge. Dr. Fauci is right when he said the virus has an enormous potential.
This past year has been a year that I don't think I can put in words. One of the biggest challenges that I think that we faced was when this virus started, it was so unknown. No one, we didn't know how to take care of it. We were changing processes and guidelines just about every day because new things were coming every day.
There were lots of different aspects of the challenge of not knowing, how to be treated, because obviously that was ever changing by the physicians within the United States as a whole. But then also our other challenges were, we are part of a larger corporation, so we do have access to supplies and such, but we still wanted to make sure that we were going to have adequate PPE, medications, all of the supplies and equipment that we needed for our staff and for our patients. And so that was of utmost concern to us as well as an administrative team of how we're going to get our hands on it and how we're going to make sure we have enough of it.
Challenges was getting used to fixing things that we were used to fixing, I think. We are fixers by nature, and with COVID, even with the resources that we have, this was a virus that we had limited resources that we could fix the virus because there's no cure.
Financially, we obviously took a hit because of just the situation. People were in the hospital for a very long period of time. We had to shut down a lot of beds.
I wanted to be around people. I really honestly wanted to be able to take my mask off and see people's face and see the expressions that they're having, because it's so odd and it's so hard to figure that out.
There are even certain areas in the brain that are for facial recognition. I remember I had patients, when I talk to my patient and they are wearing a mask and I'm wearing a mask, and I keep talking to them to elicit an emotional response. I don't know if they are happy. I don't know. I have to look at their eyes and I have to guess whether they are happy or whether they are sad. Then I have to repeat myself again and repeat myself again to get a response. So what makes us human is that we are social animals. We interact. That's how we build. That's how we built our culture. That's how we built our civilizations. We invent, we communicate, we pass down the knowledge to each other, and then we pass down the knowledge to other generations. That's what we need. We need to communicate with each other.
How has working in the pandemic affected you mentally?
I'm exhausted. It is, as an ICU nurse, I'm not a stranger to death, but this is a different kind of death. As I said, we can't fix this, and it is emotionally draining, because people have had to die alone except for us with them, the nursing staff.
It's been a lot more stressful just with, you're used to operating a hospital and you have challenges and you have, problems that you're solving. But on top of that, there is a lot more pressure. You do feel obligated to try to get whatever equipment that's needed or to try to do whatever you can do. So mentally, it is been very, tiring, which doesn't sound like a whole lot. I know it's not very descriptive.
Depression sure sets in a little bit. Fatigue because of a lot of long hours. Fear.
Kind of depressing, from my aspect as a mother, having children, seeing how it affected them as well, so it was kind of a combination.
Emotionally, for me, I had to isolate from home for almost 2 months. My four-year-old granddaughter still won't touch me unless she knows I've had a bath, because she wants to make sure the virus isn't on me. So emotionally, you'll see a lot of people walk away because of this.
Personally, it's very hard for me to even be around my family, because my biggest fear was taking it home to my family.
What is one good thing that happened to you in the past year?
One good thing, I've learned to persevere. I learned to persevere and learned that with my coworkers, we have learned that our teamwork is priceless, and we have overcome a lot, and we have persevered.
I think it brought a lot of doctors probably closer together because of the pandemic. We all had to team up and fix the problems.
The one good thing is that people got to see that science works. Knowledge is important. All evils in the world are due to lack of knowledge.
Well, I will say my oldest daughter was stuck with me at home because her college would not allow them to come back on campus. And so honestly, we became closer, her being home. It was very challenging at times.
The other day I was walking my dog, and I noticed that the flowers were blooming. Cherish the small moments that you have with your family.
It made me realize that I should appreciate every moment and every second that I'm alive, and to enjoy life, and to look at other people around me that one day they are here, the other day they might not be here. So it just taught me to appreciate what I have.
It probably made us appreciate what we had before the pandemic that we weren't appreciating before, that we now appreciate. Just to breathe, just to go outside, just to go to a restaurant, just to hug somebody. I mean, you can't even hug anybody for a year. You can't hug you're scared to death.
Thank you. And is there anything else you'd like to add on at the end?
If anything would come out of this, I would love for the community to know that, as I said, this is not a hoax. Please get the vaccine when it becomes available to you, because we have to stop this. We have to stop it. There are people that still don't want to take the vaccine for whatever reason. They think it's a microchip. They think that, I don't know, that Bill Gates is going to track us or whatever. I mean, I've heard all kinds of silly stories. Following the guidelines, washing your hands, all the things that you hear on the news are real, and they will save your life or somebody that you love. That's the take I have from that. I think that's a good take from that.
Wear your mask, social distance, apply public health measures, be responsible. Be responsible. Trust science.
I will say it took everybody in the hospital, a lot of people a lot of departments that you may not think of, our housekeeping department. Nurses, of course, our respiratory therapists really took, everyone in the hospital, to get us past that whole thing and to be able to deal with it still today. It is, I guess, going to be with us moving forward. But I think, everybody working together, we'll get there.
The last thing that I could say is I do believe this vaccine is one of our ways out of this, or to help us get back to some normalcy.
I just hope it goes away.